George Valemount.
Thank you very much, Mr. Speaker, and I would like to join with the Chair in thanking the incredible staff that helped support the work of the committee, and in particular Artur, who, as I understand this, may have been one of the first times he's clerked for a committee, hopefully not his last. He certainly kept us on time and was a very, very important part of the work that we did, so we're very grateful for that. I also want to recognize the Chair of the committee specifically, the member for Vancouver Hastings. She did an exceptional job of chairing this committee. She listened carefully, allowing space for complex and emotional discussions and finding ways to allow members to speak candidly. She did an incredibly skillful job, and for that, we are most grateful. I also want to recognize the leader of the third party, always present, always passionate, and never afraid to remind us of the important work that needed to be done. I want her to know that we appreciate that she did her homework and contributed in many important ways. As we table this report today, I think back over the months of work that was done. We heard in person, as our chair noted, from hundreds of people and received feedback from over 800 groups or individuals. We listened, we read, and we debated the steps that need to be taken. And there are some important themes that emerged. We looked at who is dying. The majority of people that are dying are young men, using alone, many working in the trades, transportation, and as equipment operators. Indigenous people are dying at significantly higher rates, and in particular, Indigenous women. In fact, 9.8 times more frequently than other women in our province. Young people and children are also impacted. Our neighbors, our friends, and our family members. We also learned about missed opportunities. Over and over again, we heard that there is a lack of coordination between ministries and organizations. We heard that over 70% of people who died had a visit with a health professional less than 3 months before their death. And 30% of those people had 10 or more visits in the 3 months prior to their death. People recently released from prison died at 7 times the rate of other BC residents. The committee learned that those are critical and important touch points. Something is desperately wrong and it must be fixed. Others who provided input spoke passionately about the window of opportunity. That moment when people courageously asked for help. And what did we learn? Wait lists, lack of resources made even more challenging if you live in a rural or remote area of this province. And it meant that that window was missed. We must do so much better. As a committee, we also want desperately for the actions that are taken to be urgent, dealing with this health crisis just as we did with the pandemic. We want to move beyond facing a crisis month after month after month. So the report outlines the need for a continuum of care. That starts with prevention and education, finding the words and the ways to talk about the risk of drug use, giving children and families information, support, and tools. But it was also very interesting to note that the most frequent issues that were raised with the committee were related to the ability to access treatment and recovery. Many presentations and submissions to the committee indicated there are long wait lists if service is available at all, depending on where you live in our province. In fact, we heard that many individuals may die on wait lists before being able to access service. It is absolutely critical that there be a substantive expansion of publicly funded and accredited treatment and recovery services. As we move forward, it is essential that we increase transparency and accountability. The report includes recommendations related to the collection of data the creation of regulations and standards, and the need to outline specific outcomes that can be evaluated and must be publicly reported. While there is so much more that I could comment on, I would like to end with these observations, Mr. Speaker. The committee went on a journey, and I can assure you the discussions were not always easy. But we worked hard to listen carefully to those who had the courage to share their stories, and also we listened to each other. It is our hope that just as we engaged in difficult conversations, that British Columbians will do that as well, and that as the government considers these recommendations, that they will move quickly to ensure that we have a continuum of care that includes prevention, education, harm reduction, treatment, and recovery. The title, Mr. Speaker, says it all. Closing the gaps, reducing the barriers, expanding the response to the toxic drug and overdose crisis. We must see significant investment across the entire continuum of care. We need a sense of urgency, and we need to evaluate, monitor, and report publicly. I'm so grateful to the people who participated in this process and stepped up to provide us with input. The report says in relation to the recommendations tabled today, and I quote, "Many are actions that need to be taken immediately to save lives, and it is our committee's hope that implementing them now will move BC out of this public health emergency." Thank you, Mr. Speaker.